if you old, how you go be? Now, children of nowadays, they see old person like winch. Can't imagine say you now you can't old. Your grandchildren can't come. They can't see you like winch. Because the environment where you dey, nothing to show, no bed, nothing, no money, you don't fit go hospital, you don't know where they take care of you. Your children are going to see you like winch. You don't understand? At that age, now what you want to talk about is that the problem and challenges where older people they face for Nigeria. Now we want to talk first before we go bring the other one where they talk about palliative. But first you go follow me talk this in a Dr. IWOT. I tell you now before, in like older people matter, be the carrier for head. Now be the chairman and director of REGIMA Community Care Foundation. In our FCT Consultative Forum for National Senior Citizen Center. Yes. He's still there for the Humanitarian Affairs, Disaster Management and Social Investment. He did there. Then be that. Good afternoon, sir.
Thank you so much, my brother.
This matter, but you never old.
Everybody.
You never old. Why you call it that?
I'm an older person.
Older.
I'm 61 years. So.
You don't go far. Welcome, sir.
Thank you. Thank you
Nigeria
so much.
Today, so now, my friend, before I leave here, you talk about, say, for other parts of the world, that they get plans for older people.
Yeah, absolutely.
People will fight war for other countries, like veterans. That they get some kind of preferential treatment for them. But for Nigeria, yeah, our pensioners, we always see them for a good school, they sit down for grant. They ask for their pension. Some young people come, if say, any need for them to even reach the old age. Okay, what did they happen? What we understand?
This will happen well. In developed countries, they have systems and structure to take care of. Whether you are a civil servant, you are working for government, or since you were born, you never work for government. There is something for you. But in this country now, you talk of old people, you are thinking of people that are retired from service and all that stuff. But there are people that, since they were born, are suffer. Farm, from the one till the age. But remember that in this country, to the age that people should live, like life expectancy for this country, you don't improve small. It was like 55 years, 55.8 or something in last year. I think the other year was also 55 point small, very small change by decimal point. So then 2020, I think about 54 point something. So you can see the improvement in life expectancy in this country is so slow, but then our population is so much. Even when you have 1% of people that have moved, it means a lot in thousands. So we have got to do something that should take care of people that are old. They have a lot of problems. And older persons, just as I was trying to put across before coming in here, there are about 3 categories. People that are 60 years to 74 years. They are the young old. Okay. And the civil service, they will force you to leave the civil service and immediately you are 60 years. It's a regulation, someone is there, so you must leave. Whether you are still active, you are not, you must leave. And I think sometimes some other sectors have increased it to 65. Judiciary, people are having, so all those ones, so when you have, for business, people can still be useful even after 60 years. And then you also have people 75 years to 80 years who are referred to as aged. That is people that are aged people. Then over 80 years are very old. They are very old people. And so every segment has its own challenges. But the very important one, particularly an environment that is also organized before now, because now, when I tell you what is happening with National Senior Citizen Center, you'll be amazed.
I bet tell
that
us.
Older people should be jubilating. The immediate past administration of Buhari did a lot of things. There is a law in this country now, a very important law establishing an institution under the Ministry of Humanitarian Affairs, Disaster Management, and Social Development to take care of older people. In fact, to pull them together, so people should know what. You see, in this country, we are having millions of them, over 50 million of people, population should be old people, and we are looking at 4.5 to 5% of the population being old in this country. Though it is not too much compared to other developed countries, but the small percentage that we have had older people come. As I said earlier, that 1% increase is a lot. With a population of over 200 million, you have 1% increase is in thousands. So that makes it very important to us that government, the immediate past government, I'm very sure this government is, because I saw what this government is also having in their health plans, very important. So when they continue with this thing, I mean, it's going to be very wonderful. So it's an institution established by 2017, 2017, this law was enacted by the National Assembly, and the establishment of the National Council of Senior Citizen Center was also done, and then the inauguration happened. And right now, they have established consultative forum in each state. So 36 states and FCT has this consultative forum. You just mentioned and a vice chair, and every consultative forum has 6 subdivision or thematic sub-teams, and then one co-chair and one another co-chair, making 2 co-chairs, co-chair 1 and co-chair 2. And they are working directly with government of each state to make sure development, to make sure that they include older persons in their plans. But right here in the center, so many things are also happening. Partnerships, creating partnerships, that there's continuous engagement. That when you are 60 years, some people have been trained, some are having, so they are artisans. They can weave, they can do nets, they can fish, they can farm, so many things. So it's not only civil servants that have retired. Some are doctors, some are engineers who are 60 years, some are politicians, they need this too. So the space has been opened up that these people should also come in and continue to serve and contribute to the economy and to our own development. So, and they are like think tank, having that knowledge base. They can, do a lot of things, not only for government, for the society. So this NSCC, the National Senior Citizen Center, has created that area that, in fact, it was launched about a month or some weeks ago, and there's a website that older people, you just key in there, put in your own specialty, or if you are an artisan, what you can do. If you are still strong enough, then some people will now pick you up and still engage you as continuous engagement. Then you can see what is happening in Oshafa. Women, older women have formed a cooperative, and they are having about 20 hectares of land that they are going to find for particularly cross with an agri value chain, put in place. So all these things are empowerment. And we are also having situations that you are having people that are old and they need support. But yes, you have access to finances, you have access to resources, particularly financial resources, and you are having a welfare card, that you are having a social care, that somebody is now giving you discounts. That is happening abroad. That people are having the discount.
The card there.
It has been approved. And the banks are keying in. The card will even get.
The card will even get.
So, not talk
that one. Not talk that one.
Something is going to happen.
Not talk that one. Our politicians. If they need to go abroad, we not go abroad. If they go treat themselves for there.
The politicians will be part of. They will have that card. They all of the 60 years and above.
We'll leave that one because we not say they will keep hospital here. They go wrong, go abroad.
But let me tell you another important one. That people that are old, they know many things. We are telling them about the challenges that they have. Particularly those that they don't go to school, that are staying in the village. They grew up there. They suffer there, and they are old now. People have abandoned them. The women that used to take care of them, they are now going to school. They are coming into town. And those that are staying back, they are cut off. They are also growing old without having anything to help them. So there is going to be training now. The curricula to train them for the first time in this country have been developed. So people will now be trained, even those that have never gone to school, they have to take care of older people at home in the villages. And those that have class 5, those that have JSS 3 that want to also take care of other people, you'll be trained. So the curriculum and the career path have all been approved and is going to be implemented within the year. So this is another one. So people used to leave this country to go and do caregiving in London, in Washington, in North America, or in Europe. And then now this is going to happen here. That we are going to train people here. They will be carefully employed. In fact, people that are in the formal training can even be employed by government, and they take care of other people. And those that are not having formal education will be trained to take care of people even at home. And that will be fine. So you are seeing people having issues of health. Okay. Because
you talk about health.
Yes.
Which provision you feel say they're supposed to keep for ground so that older person will fit access health care?
Thank you very much.
Most times they need aids, either to carry them for a wheelchair or somebody need to hold them. So
devices.
If for instance now we're for Buhari Area Council and no better health care facility here, the health care facility is supposed to be Metama or Gariki. What will be the plan?
Even my Metama Gariki that you are mentioning, they are not adequate. They still have to train people to take care of older people. They have specific and special needs. Because as we are getting old, we are migrating from where people are talking about polio, other stuff. No, they still occurs. But you are looking at the diseases that of old age.
Like which kind of disease?
Apart from the aging alone, that your nervous system, your muscle mass is reducing, your sensitivity, many things are changing in you, but your memory, all those things are coming up. When you see people in the village and say that this is a witch because of old age, this may be natural aging process that people are not aware. So with what I'm telling you now, that we are bringing the awareness, the NSCC, the National Senior Citizen Center is bringing awareness, and very soon it will be something that somebody will know exactly that this older people that we are saying is, and NAPTIP is also coming up, because these people that are abusing older people, there are numbers that people can call and they will take action. They are taking action several. We have seen a situation in Florida State, and then it was another state that older people were being flogged out of stuff by the caregivers who are not trained, and they were reported to NAPTIP. I think action has been taken. So people should be aware, and so that they don't come with the phone numbers here. Otherwise, they would have given them, so people will call it. Place you see older parents being maltreated, even by the family members, should be reported, and intervention will be done. So, like we are saying now, that even the care of other persons, you go to the hospital, you can take yourself there. There is no provision, special provision for you to be taken care of. Out of respect, you still queue up, you have to go to, so all these things will be taken care of. People will be trained. Doctors, nurses, if you are not doing geriatric nursing, if you are not a geriatrician, if you are not a gerontologist and all that stuff, there are some specialty that people will have to be trained. So even the existing health personnel will have to be trained. And there is the integrated care of older persons, that care of older persons are being keyed into primary health care subsector of health. So you can now see even the community arrangement to take care of older people for long-term care, because these are people that will need long-term care, people that cannot take care of their daily activities will have to be supported. So people should be trained, and the primary health care extension workers will be trained to take care of that. There is something that is known as the chief agent, the community health influencer promoter agents that will be put into that place to also help. This is not hearsay. This one is what is going on. The WHO is driving this in good partnership with government. It's a global movement, and Nigeria cannot be left behind. It's a charter that we signed, and it's coming up now with the establishment of the National Senior Citizen Center, which is a critical focal point. There's no going back for Nigeria. And Nigeria is on top of this. In West Africa, in fact, in Africa, we are part of the top performers in this. And I believe by next year, things will be rolled out in a way that people will just be wondering what is going on in this country. So we are looking at a situation that the needs of the older persons will have to be very clear to everybody. The neurological needs, where you have dementia, you have forgetfulness, somebody cannot, some of them are going to fall, the muscle mass is weak, the skeleton, everything is depreciating. So these kind of people cannot take care of them on the situation. They need help. They need people to assist them. Don't mind some of us that are still strong. We can move around. We don't know our age. But there are some that when you see them, they are frail. They can't help themselves. So we are looking at a situation that this kind of people should be taken care of. They can even stay in the institution, modern care center. It can be built in the community, can be built in the ward, can be built in the state headquarters, local government headquarters, so that people will be employed and put into that place. And people will be trained to also take care of that. So we are also looking at the situation that those that can also help themselves, the health insurance for older persons. If you know, there is the National Health Insurance Act that was signed into, a bill that was signed into the Act last year, based provision for vulnerable funds, that people that are women and children under 5 years and older persons will be having access to that fund. So that fund will take care of the health needs, the care package, because we now appreciate that the older persons have many of their health needs will be those ones that will cost so much. They will need devices. They will need assisted care. But if government wants to do anything now, which database government want to know how many? Thank you very much. Thank you very much. The database is not there, but the NDAEYO in its own wisdom has started going into the existing database. Which database for the population? How many years will they do population last? Some people we don't old. Like you now, the last census, you never reach old people. But that projections. They have projection. The annual projection for the country is 2.3 or 2.4.
But we not get details. We not get database for people who don't die for Nigeria. Because people when they die for village, they carry them go mortuary.
Documentation. That's what I'm telling you. You need national population to document all these things. When people die, there is a death certificate that should be issued.
So people when they collect certificate,
you must get death certificate, but people are running away from this. They don't even know. So we need to. I think we need to sensitize people more. But good to know that there are other areas that you can also get data for people that are 60 years and above. The NIPSI. Many people have not also registered it, but that is another good source. People 60 years and above. If you go to the hospital, there are clinics around. You can also get people 60 years and above because every card has age and sex. You know, whether you are male or female or not. So we have all those people that you can for now. And the NDAEYO is making a deliberate effort. There's a partnership with with the National Bureau of Statistics that they have to do census. They have to do data evaluation for people 60 years and above in this country. And it's by so doing, and even the APC, National Population Commission, with the census that we are about to have now, there was a great advocacy that we have to categorically, look out for that age group. This is above, so they have agreed. So I believe that when the outcome of this population census that will come will also give us another. But the one NCC is planning is the specific multi-variable survey for people 60 years and above, and that will be done. I think they are in an advanced stage of rolling that out.
Before you go, make I ask you this question. See whether we like them or not. With the as you do so now, you don't pass 60.
I don't pass 60 for myself.
What if person do to fit prepare himself for old age? Yes. As young people, they watch us now. What do we fit do to prepare our? Because we must reach there.
You must reach there. It is a blessing.
So what do we go do to prepare?
Number one. You must take care of yourself.
How?
You must watch what you eat. What you eat, avoid alcohol, avoid all those things. They are in the open space. What you should do, even when you are eating vegetable, fruits, in moderation, because when you pack a whole basin of fruits and eat, it's also a problem to you. Okay. So you have, in fact, we have to balance our food. We have to look for complete foods and eat. So a little of fruits, a little of carbohydrate, a little of protein. So, and at every stage of growth, the need for carbohydrate should be known to. When you are very small, young, very active, vibrant, running up and down, you need carbohydrate. Okay. When you are aging, you don't need much of carbohydrate again. You be very small of glucose to energize your brain or of stuff. Your activities are lower, so you don't need too much of that. So you are thinking of vegetables and minerals and vitamins more at old age. Then you are looking at someone to try to have a means of livelihood. You have been to school, and you have not been to school. You have a trade. Whether you are a businessman, you are a farmer, or you are not specialized trade. So you can also do that. What is happening now? That even when you are aging, when you are old, you can still key into the national social empowerment programs that are coming up and as I mentioned those cars. It doesn't matter whether you have been to school or not. All what you need to do is to register with the National Identity Management Commission. When you register with that, you have your name, you are already set, because the banks are the ones to issue those social cards. So if you have those ones, at least you have a guarantee, you will be able to. Then the people that are having older spaces now should also look at what is available around them and the kind of sickness people are having. So if my father is having cancer, then I have to begin as a younger person to know how I live my own life. And if they're having hypertension, you start early to go for checkup and then get the advice of doctors. If you have diabetes, these are the common diseases that affect the non-communicable diseases. And again, older people also need vaccination. Pneumonia, we had COVID outbreak. They were part of those that were really targeted for the vaccination. Apart from being vulnerable in terms of aging and other stuff, they also have issues with the comorbidity. So you see that they were really targeted. And so we have to watch the trend of our lives, and family issues could also be limited by environmental control. So I come from a family that all the food we have is carbohydrate. So we should have a way to also plant citrus fruits, plant fruits around.
Okay, this one they talk so vegetable.
These are things that we should.
Vegetable no dey belle full person. Na food when you go chop your man go press your belly whether it don't strong.
You know what I learned? That if you are, that the size of your heart is just about the size of your fist. Yeah. If you take about hydrate this size, that is okay. So it's not for you to have full a big bowl of fufu. Eating that. If you eat like that, see my name, like I take this size.
This one now, person go swallow and once. If you go to village for Akwa Ibom, you go know they talk about that. With that kind of fang soup wey thick, my country people are saying they be for wetin dey happen. Una don hear whether you like am or not. Old age supposed to be a blessing.
Absolutely.
To all of us.
Yes.
Dr. IWOT, Inyang, chairman director for REGIMA Community Care Center. In the municipal way they take off old people, he like their work well. He did that place. Let me invite him. Come tell us. What we need to do? Now don't hear. Mind your lifestyle. The kind of food you eat, everything they bring smoke, you put from out. Make we use ourselves. If you want old, make it not give your family problem. Who will mind the kind of food we eat? Eat vegetables often. Not eat them too much. Eat them. Small. Maybe so you both they chop, more they chop like that. My name is Ekanem. Inyang.